Well, good evening, everyone. At least it's evening here in Tucson, Arizona. My name's Paul.
Good evening here. This is Bev.
Hello, Bev, and we have our health condition workshop today. So, we're going to talk about lymphedema and lymphatic health. So, we're going to have a presentation, and then we will have a teaching of the sets of points that can help with lymphedema and encourage lymphatic health. If you want to follow us with that, go to and learn with the sets of points. Go to justtouch.com/workbook, and you can download the few sets of points that Bev will teach us after the presentation. So, without further ado, we will just go right into our presentation and we'll be back with you after that.
All right, thank you. All right, so I'm here to talk about lymphatic health. And most of the times I start out, people want to know, how did you get started with this? What made you want to get into lymphatic health? I am like most people. I had never heard of the lymphatic system, maybe lymph nodes, but that was about it. I ended up, I used to be a I used to be a CFO of a behavioral health center. And so I had a lot of responsibilities on me. Over time, what happened was I developed a chronic cough. This cough, I first thought, was the result of my eating too much dairy products, maybe. And somebody, love pizza. And I do like cheese. And so I figured, oh my goodness, I need to adjust my diet. But then I began to realize that when I was in stressful situations, this cough would appear out of nowhere, like 40 going north, and I would be in full blown cough attack. And it would take me a minute, take me a few seconds to get my breath together so that I could calm down and breathe and carry on. And so as that kept happening, I said, well, let me go to the doctor and find out what can she give me to stop this from happening, because it always made me feel like people thought I was weak because it happened in stressful situations. It happened when there were times of confrontation, and the cough would happen before I can make my point. And so I went to the doctor. The doctor told me, after all the tests, she even had sent me to a specialist, respiratory specialist. And after everything was said and done, she gave me 3 prescriptions, and one was for an inhaler. Because I asked her, okay, what is this one for? What is this one for? What is this one for? And she said, you're going to have to get an inhaler. And I said, oh God, I don't really want to do that. Is there anything that you can tell me I can go to the health food store to get that could help? The look on my doctor's face, I did not understand it then. I understand it now, but that look that she gave me, she looked at me real good, eye to eye. Then she shoved her hand into her white coat and pulled out her personal inhaler and said, you're just going to have to go and get an inhaler and take it for the rest of your life, just like I do. And she shoved it back in her pocket and walked out of the little room. I sat there thinking, oh, that's not going to work for me. I got to figure out something different. So I waited for her to come back because I had more questions. She never came back. I asked the nurse, is the doctor coming back? So, well, no, she's in with another patient. So I guess she's done. I tore up those prescriptions. I don't, I'm not telling anyone else to do what I did. This is my story. All right. So I tore up those prescriptions, and I decided to find out what could I do without taking some type of pharmaceutical to help. And that led me on my journey, my health journey, the journey to find out how to stop this cough, or what can I do to 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 be able to help myself. And I learned a lot of things along the way about breathing. Breathing was one of the first things that I encountered, breathing exercises. And I thought, wow, this is really helpful. And it doesn't cost me anything, and I'm breathing anyway. I was learning how to make breathing work for me. And I thought, this is really great. And so the next thing that was of a milestone on my journey was one of my coworkers. She purchased a NutriBullet. NutriBullet doesn't pay me anything for this, but she purchased a NutriBullet. And we were both so excited about all of the different concoctions she was putting together with fresh fruits and vegetables and, nuts and seeds and all of that thing. And every day she would come in and I would ask her, well, what did you fix today and what is it for? And I finally decided to get one of my own. So I went out, bought a NutriBullet. Now you just don't know how excited I was because I was looking up different recipes that were dealing with the respiratory system that I could try. And so this little back and forth thing that we did every day just led me on further down the road. And I ended up going to and we all use it, YouTube University, to find out even more information. What are other people doing with their NutriBullets? I ran into a guy that was interviewing a gentleman. This gentleman's story intrigued me so much, and this was another milestone along the way. He was talking about how his doctors had given him up, told him, listen, there's nothing else we can do for you. You need to go home and get your affairs in order. You have about 6 months to live. And he encountered someone that told him, I know somebody that can help you. The man that he met said, I can help you. One of the first things that you're going to have to do is obey everything I tell you to do, because what I know works. And after they talked that first time, the man told him, you're going to have to forgive. You have things going on, after their discussion that you need to forgive. This unforgiveness is not going to work. And I thought that was really interesting because I'm a vibrant life promoter. I promote vibrant life by having better health through activating your lymphatic system. But I'm also a pastor as well. So I thought that is really interesting that was one of the first things that he told him he was going to have to do so that he could get better. And I've seen this also work in my dealing with different clients that I have worked with. Unforgiveness is a killer, and there's no pill for it. That's that inner work that you have to do. And so he talked about all of that, and then he's talked about the lymphatic system. He told them about bouncing on a mini trampoline, and that made me lean in a little closer. Bouncing on a mini trampoline is supposed to help you feel better, help you get healthier. I mean, healthier, to turn around this man's health from being on the road to death onto the road to better health and life. Oh, wow, that intrigued me so much. I began to study about the lymphatic system. Who did this man learn from? That's what I wanted to know. I found out about the man that he learned from, and I read everything I could and just gleaned what I could. Then I wanted to know, who did he learn from? And I found myself, as I kept going back and back I found myself in the 1800s. I said, this has been around this long, and this is something that really works, and nobody's talking about it. Why haven't I heard about it? Why didn't my doctor tell me about this? That is what, really, it just really got me the most. This is something they know about, but nobody's talking about it to help our society. And so I ended up going to the International Academy of Lymphology, which was started by Dr. Carl West. And he was one that found a formula about how to, anyway, let me not go down that road. It's just like, let me get straight to the point. The lymphatic system, it is the most, I would say, from where I stand, it's one of the most important systems of the body that we need to know about, because it helps to cleanse all the other systems of the body. It helps to balance the level of fluids in the body. When it's not working properly, you end up with loss of energy, pain, and a host of other conditions that they give names to. If you got it, your lymphatic system is not working and you have a buildup of cellular waste, a buildup of trapped blood proteins and fluid, they call it, if it's in the eyes, they call it glaucoma. If it happens in your joints, they call it arthritis. Depending on what's going on or where, they've given them different names. But this buildup of cellular waste and toxins, this buildup of trapped blood proteins and fluid from the bloodstream causes inflammation. That inflammation is at the base of most all conditions of illness that are known to man. You know, when you listen, if you listen or track or find out or ask enough questions, the bottom common denominator is inflammation. So we deal with a lot of our things that are wrong with us, dealing with the symptoms. And I'm sure you learned through BioTouch, you know, how to get to the real issue, because when you can heal the real problem, the symptoms go away. That lack of energy, brain fog, not being able to sleep well, having chronic fatigue syndrome, your immune system being compromised. And then the best thing of all is your vitality, that feeling youthful and young at heart, no matter what the numbers said. So the lymphatic system, how does it work? The lymphatic system works in conjunction alongside of the blood system. So when you think about the blood has a pump, which is your heart. Now the heart helps to pump the blood away from the heart and back to the heart. The lymphatic system has lymph fluid, and that lymph fluid needs to pump and circulate through the body as well. The issue here is that the lymph system does not have a pump. You are the pump. Movement is key to the lymphatic system working at its optimal level. When it is working properly, it's going to help to vacuum. It acts like a vacuum that will vacuum out the excess trapped blood protein, trapped fluid from the blood system, and any cellular waste. You know, we have cells that die off every day, and then we have new cells being regenerated. But the problem is the cells shouldn't die off and then stay where they are. The system of the lymphatic system helps to draw them away from where they died off, and so that they can go through the lymph nodes and be filtered, and the trapped blood proteins and fluid can be filtered through the lymph nodes and go back into the bloodstream. And when everything is working optimally, you're going to be in good health. Good health. You have proper amount of oxygen around your cells, because when that buildup is in place, oxygen is not at its optimal level. And a key thing about that is that oxygen is what heals. It's a beautiful thing. And so what's the best way to work your lymphatic system? Well, you heard me say bouncing on a mini trampoline. That's the number one way to help activate your lymphatic system. That bouncing, what's so beautiful about the bouncing, you can do what's known as a gentle bounce or health bounce. In my world, we call it lymphasizing, because the focus is not trying to get a cardio workout, but rather to work your lymphatic system. And it does not take that much to do it, just a gentle bounce. So anybody can do this bounce. And at the bottom of the bounce, there are check valves along the way of the lymphatic system. At the bottom of the bounce, those check valves open, and the lymph fluid can rush up, can flow up, because it only flows in one direction. Unlike the blood going away from the heart and back to the heart, the lymph fluid only runs upwards. And so at the bottom of the bounce, the check valves open and the fluid runs up like it should. It helps to activate those vessels that suction out that excess of buildup wherever it may be in the body. So you have a system of lymphatic vessels that are from the bottom of your feet all the way to the top of your head. So bouncing on a mini trampoline is the number one way to activate your lymphatic system and to help it to maintain its optimal level. The number two way that I promote is breathing exercises, because breathing is something that, again, you're doing it anyway. Why not make it work for you? It helps to, when your diaphragm is moving upward, up and down, that up and down motion, that helps your lymphatic system also to have that how can I say, that up and down motion throughout the body, because it helps to contract the muscles, and it can cause something that's going to help those vessels to work and to help the check valves to be able to open as they should, to release the lymph fluid to flow upwards in the body. So other ways that you can do, you may have heard of lymphatic massages that you can get, and they're nothing like getting a deep tissue massage. It's very light because your lymphatic vessels are right under the skin, and a gentle touch is all that's needed to help to move lymph through those vessels. So that's the basic things to know about the lymphatic system. Bouncing on the mini trampoline, or even doing your breathing exercises, just doing it like the bouncing, if you do it 3 to 5 minutes, and in some cases, if you're having a problem like lymphedema, or you know that you're having a swelling because of the inflammation, that buildup, or maybe you're dealing with the fatigue or pain in the body, you don't even have to bounce that much. Just bouncing, as much as you can, a little. I would say, when I work with people, sometimes we're talking seconds at a time, depending on how serious the condition is. Well, you can stand on your feet and lift your heels. Lift your heels up and down, up and down. Yes, that's helpful. And walking, just the motion of movement is what's key. In our society today, we have come to such a place where we sit, just like we're sitting here. You're sitting there watching. We're sitting here talking to you. I'm talking to you, and you do so much work from your computers, your handheld devices, whether it's laptops or whatever. We sit so much. So it's really important for us to move, because that's what God intended, for us to move our bodies. So if that's walking, you asking me what's the best exercise you should do, I'm going to tell you bouncing on a mini trampoline. But if you don't have a trampoline, get up and move your body, dance around, take a walk, do some jumping jacks, do the twist, do something. You always tell the people, you got the power to help your body, help you have better health and a more vibrant life. I wrote a book about it. That's the name of my book. You got the power. And it's 7 ways you can transform your health and peace. Because when you have peace in your body, as I said, just think about having peace in your body, peace in your mind. Your health is going to benefit from that. When you got good health, you have that peace in your mind and peace in your body. But when one or the other is disrupted, it's going to frustrate the other. So, it's important to do what you can. If you're under a doctor's care, follow what your doctor tells you to do. But you're breathing anyway. Why not make that work for you? Your doctor can't move your body for you. You have to move your body. So these are things that you can do. Getting fresh air, getting sunshine, these different things help you overall. But I have found, I was just reading it the other day, I haven't read it in a while, but if your lymphatic system is not, like, if it's shut down in 24 hours, you're out of here. I mean, dead and gone. That's how important it is. I was watching a documentary just to prove this. I was watching this like a 60-minute show, actually. And there was a man who was uh, uh, a producer of movies, and he went to a conference. When he got to the conference, everything was well with him, but he began to feel kind of sick. He didn't know what was wrong. He told the people at the hotel, please tell me where the hospital is. I need to go to the hospital. He got to the hospital. They ended up admitting him. He was his organs was shutting down, and they couldn't tell what was going on. They was doing every kind of test they could think of. They told him, listen, who is your next of kin? You need to go. He said, my next of kin. So you need to call somebody, because if we don't do something in 12 hours, we don't know. You got like 12 hours here. 12 hours. And as I was sitting there watching, I was saying, his lymphatic system, I bet you it's his lymphatic system is not working, and it's everything else is shutting down. And they brought in a specialist, and wherever they flew this doctor in, and once he looked at him and checked him and everything, that is what he found out. His lymphatic system was failing, and all the other systems of the body were shutting down. So it's something that we don't hear about as much as we should. I'm here to tell you that you got the power to help your body help you. Movement, it will help you. Doing breathing exercises will help you. And, just taking some responsibility that when we do our part, the body already knows what to do. When the conditions are right, the body will heal itself. So of course when it comes to eating more fresh fruits and vegetables, that's helpful. That's not going to frustrate the lymphatic system. Eating more cruciferous vegetables like cauliflower and Brussels sprouts and broccoli and things of that nature are really good. And berries are good. Drinking enough water, clean water, is good. That's going to be helpful to you. Not wearing tight clothes. When you wear tight clothes, it can not only cut off the circulation of your blood, but it can hinder the circulation of your lymph fluid being able to circulate properly as well. It's just seems like small things, but this is what God intended, that when we do our part, the body naturally knows what to do to keep us healthy and to keep us in good health. So that's really what I wanted to say. If anybody had any other questions, or if you all have any questions for me, I would be glad to answer them.
Well, I'll tell you, what's nice about your presentation is it's simple.
I love it. Well, and it's so perfect for us. What a great partnership, because what you say, help your body to help you and take responsibility. That's what BioTouch is here to remind us all to do. It's perfect.
So somebody had a question. Is there a specific breathing technique that you give people, your clients at all?
One of my favorite that I share with people is the alternate breathing. Everybody talks about box breathing, 4 breaths in, hold for 4, and then breathe out for 4. But alternate breathing is the beautiful thing. So just right quick, when we should breathe in and out through the nose, just your regular sitting around breathing. Breathe in and out through the nose, not mouth breathing. That can be a problem. Mouth breathing can lead to over breathing, which can cause all of the different respiratory issues like asthma and even sleep apnea. So the way you breathe in the day is the way you breathe while you sleep. That's important to remember. Sleep. Alternate breathing goes like this. I'll show you first, and then we'll go through 3 counts that you can do this with me. So when we breathe, just to tell you about breathing right quick, when you breathe in and out through the nose, what God intended is for the air to be warmed, the air to be filtered, and then the best thing is that the lungs knows how much air is needed at any given time. So when you breathe in and out through your nose, you won't overbreathe. And so when you breathe it in and out through the nose, also that that oxygen can go to the deeper parts of your lungs where the rich blood is that gets recirculated through the rest of your body. So here's alternate breathing. We're gonna take one finger, close off close off your right nostril. Then we're gonna breathe in through the left, and it's just not a deep over, just regular breathing in through the left. We're gonna hold it and then alternate. So you breathe in, hold it, alternate, breathe out. Breathe in, hold it, alternate. So this is how it goes. So you're gonna go in, out, in, out, in, out. So you want to try that with me? Let's do it. Let's do it together. Everybody that is listening. Okay, so you're gonna hold one nostril down. Okay, you're gonna inhale, hold it, exhale. Inhale, hold it, alternate, exhale. Inhale, hold it, alternate, exhale. I do that every morning. Every morning. You can do it at any time. That's the beautiful thing about breathing, because you're breathing anyway.
Perfect.
But I do it every morning, and I do it until what will happen. This is called listening to your body. When you do it and you just keep doing it, you're going to get to a place that when you get ready to take another breath, you'll feel your body will let you know that's enough for now.
Perfect.
It's such a calm peace. I was showing somebody on another interview the other day, and the comments that were coming in, oh, the pain in my back just went away. Oh my God, I didn't realize I was stuffed up. My head is clear. And I was like, wow, beautiful.
Yeah.
You know, so just you can do it in the morning, help to get your systems and stuff going, and your body will let you know when you've done enough for now.
Wow.
Well, Hillary, you have
thank you, Hillary, for
been
that. That's
simple,
a
inspirational.
Welcome.
We're glad that you took that path of taking care of the lymph system and sharing us some really simple things. Hey, anybody out there that's watching, HillaryGooden.com. She has that book again. What's the name of the book again?
The book is You Got the Power.
You Got the Power.
Because I believe you got the power.
You got the power.
7 ways
right on. So if you want her book and
your health and peace.
Yep, and I'm assuming you work with clients too. They can contact you at HillaryGooden.com.
Yes, they can contact me there, or they can direct message me on LinkedIn or Facebook.
Okay, perfect.
Yeah.
There we go. All right.
Wow.
I forgot how great that little presentation was.
I forgot how wonderful that presentation was.
Yeah.
You know, well, maybe we'll talk more about this on Monday. I don't know. But there was a few things that when you go back a second time or third time on some things, you pick up things you did not the first time. But I'll tell you what got to me. We're going to probably do this anyway. She talks about the lymph vessels being right under the skin, and what it takes is a light touch on the skin. I'm like, okay, that is BioTouch.
There you go. And so on this particular workshop, we'll just take you right to the BioTouch, that light touch. And then when we're done with the teaching of it, then we'll even show you how to locally work some of those pained areas. Again, if you want to follow with us, download the workbook at justtouch.com/workbook. And we'll have Bev. Sorry for those who are on Facebook. We're having a trouble getting on it, but you can get this on YouTube. Also, if you know anybody that's going to want it, this will be sent out in the email, the recordings of all this, so you'll be able to watch it later on too. So let's go right to the workshop of how to do BioTouch. Take it away, Bev.
All right. So for those of you who have downloaded or have the workbook, just to go briefly over that front page, that first page is always titled the condition that we are addressing and a overview, some basic information about that condition and how, of course, how it BioTouch can help address it. So we're going to go then to page 6, which is the next page. And for those of you who are new to BioTouch, and those of us who have been around for a while, it's always nice to kind of remind ourselves some basic information about this amazing technique. These 4 bullets, we'll just address those real quickly. First of all, the definition of BioTouch is one person touching another person lightly on the skin. BioTouch is a relationship of healing between 2 people. And we, as associates and recipients, there's an exchange in this amazing practice. So let's go ahead and look at this first bullet. BioTouch is easy to learn. Children have learned it and practice it. It's really part of what our message is, that the younger that you can learn BioTouch, you can already start to incorporate it into the family unit where all the family members are receiving the benefits of practicing BioTouch together. It's easy to learn. Part of the reason we started these health condition workshops was to address specific sets of points, and then you can go on from there. So, but the technique itself is very easy to learn. And again, you can practice it effectively. Everybody in that family, children. BioTouch is a complement to any healthcare program. Hillary was saying, if you're under a doctor's care, follow their guidance. But BioTouch is a integrative modality that works with absolutely everything, whether it's a special diet or you're on specific pharmaceuticals or you're doing other modalities or whatever it is. BioTouch is only going to enhance that healing journey for you. BioTouch has no levels of ability. Everyone is effective the first time. So the minute you learn the sets of points in this technique and you can practice them, you're going to be immediately effective. You don't have, there's no waiting, going through, a lot of lessons and getting initiated by anybody or being, 5 years out, you're finally ready to practice. No, this is absolutely immediate. And the reason is that BioTouch is geared for every single one of us. All of us already have the ability within us to do BioTouch to help another human being. So there's no talent you have to have or you don't even have to know the anatomy. BioTouch has its own language, which is geared for everyone to understand. So it's an amazing gift, actually. BioTouch requires no special preparation, belief, or state of mind. So you do not have to prepare a room to get rid of any negative energies or vibrations. You don't have to prepare yourself to protect yourself from another person. You don't have to think about it and, meditate before. BioTouch is in the moment. We don't have a belief system. We don't have a philosophy in this foundation. Everything is honored. And when you start to practice BioTouch, you will find that your ego just goes away because it brings you into the now, the moment with another human being. And that is when healing takes place. So that's the basics of BioTouch. Let's talk a little bit before you start a session with someone. We always want to wash our hands. Again, BioTouch is one person touching another person. We're always going to begin every session, even if you only do one other set of points, you want to do the greeting, which will be the first set that we're going to introduce tonight. It's always the first two fingers of both hands. You're going to touch lightly on the skin in a butterfly-like touch. Every point that you touch, you hold for 6 to 8 seconds. BioTouch can be practiced anywhere, anytime, with anyone, any place. So that is the basics of it, actually. And tonight, if you choose to help someone after this presentation and this workshop, if you choose, you are going to be immediately effective for that person. It's an amazing gift, like I said. The next page, those terms that are used, those are just ways that are described on how you can apply BioTouch, but we don't go into those. We do in the BioTouch practitioner training when we introduce it more. But for tonight, we're just going to talk about those first two bullets. The associate, this is remember the relationship that is developed when you practice BioTouch. The associate is the person who will perform the sets of points. And we use the associate because, as the dictionary describes the associate, it is one who is inspired to often work in the company with another, which implies that relationship, and an intimacy or an equality. This is one of the great things about BioTouch. In a true relationship, it is there's an equalization. Somebody gives and somebody receives, both of them. And the other definition is one having an interest in common with another. When you practice BioTouch, you both are pretty much on the same page. The other part of that relationship, the other person we call the recipient. This is the person that is receiving BioTouch and benefiting from those sets of points. So that is that's the main things that we wanted to always cover with you. And Paul, you want to just do your little thing there?
My little thing. Here's my little thing.
Yep.
All right. So if you have the workbook or if you get the entire ebook training manual, each set, except for the back set, which we don't go over on these workshops, each set has 2 pages. One is a drawing that has numbers, which are where the points are, and the description of where those points are on page 2. They're exactly described where to find the points, and we're going to show a video with each one of these sets. And if you'll notice here where it says click here to watch video in purple, that when you click on that, it will take you to the video that you're going to see when Bev shows us the different sets of points. So it's very easy. And then there's always pictures, as you can see there, pictures of people doing the points. And so those 3 ways, there's just no way you can go wrong. Remembering, you don't have to be exact. This is not a science. You have like about an inch to play with. So find the points as best you can. And if you ever have questions, you can always contact us.
Yeah. Okay. Thank you for that. So as I said, we're going to introduce the greeting, the first set tonight. This is just to remind you, always do the greeting before touching any other part of the body. It sets up the harmony between the associate and the recipient in that relationship. The only difference in the greeting from all the other sets of points is you're only going to use one hand. That will be your dominant hand. And we'll see that in the video when Paul plays that. So always just your dominant hand. And as you can see, there's only 2 points. So it's a very easy beginning to practice BioTouch. And so we're going to take a look at the video and see what it looks like to give the greeting.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay, so let's go to the next set, which we call the heart set, which includes the veins, blood pressure, and circulation. And if you'll remember, Hillary was talking about the heart pumping, circulating the blood through the body. And so this is a really good set to help with making sure that that circulation is doing well. So let's go ahead and watch the video of the heart set.
This set of points may be used for conditions relating to the heart, veins, blood pressure, and circulation. To perform this set, first find hold point X, which is on the breastbone, directly between where the nipples would be on a youth. Another way to find X is by measuring 1/3 of the way up the breastbone from greeting point 1. To address the well-being of the heart, hold X and with the other hand touch points 1 and 2. These points may be found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this diagonal line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. Veins, blood pressure, and circulation may be addressed by touching point 3 in addition to points 1 and 2. Point 3 is at the soft indentation just above the collarbone, above and to the left of the notch at the top of the breastbone. It is the same as point 1 in step 1 of the metabolism set. Remember to hold each point for at least 6 to 8 seconds.
Okay, the next set is called the metabolism set. This is a really, really great set because it really helps the body to release what it doesn't want and to assimilate what it knows it needs. As Hillary was saying, the body knows, and this metabolism set really helps. For instance, it helps with fluid retention, which is one of the things that happens with lymphedema. It helps with arthritis, which is an inflammation problem. So this is a really good set to be using for lymphedema and other associated problems in the body. So let's go ahead and watch the metabolism set.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay, the last, well, there are actually 3 sets, if you'll see: infection, allergy, and poison. But Paul, I think for our purposes, we just did the poison set, right?
We'll just show the whole thing.
We'll
Right.
show. The poison set helps the body to get rid of toxins. So this is a really good set, but we'll watch the video and it'll show all 3 sets.
The infection, allergy, and poison sets are 3 separate sets of points. They all share the same hold point, which is the same as greeting point 1, located in the fleshy area just below the base of the breastbone. As with all sets of points, these may be touched repeatedly. Infections of any kind anywhere in the body may be addressed by holding X and with the other hand touching point 1, which is at the base of the large muscle on the right side of the neck and slightly above and behind metabolism point 1. Allergies or allergic reactions may be addressed by holding X and with the other hand touching point 2, which is on the right side of the neck directly behind metabolism point 3 on the top of the large muscle. To address poisoning within the body, hold X and with the other hand alternately touch point 1 and point 2.
Okay, so that's, actually, she talked about allergies, infections. So
Yeah.
all of that are all part of a lymph system that could not be functioning properly. So you could just do all 3.
All
It's
3,
going to help.
Yep.
And then there's another page that we're just going to talk about, and that's local work. So when Hillary talked about like lymphatic massage, you can then take the index and middle finger of each hand and then lightly touch, like she talked about, wherever you feel that lymphatic system is locked up or it's not working, whether it could be around the breast area. Sometimes women who have breast issues, and we've had other workshops with that. It could be in the groin area. If you know where the lymph system is, you can just touch around it. Or you can just take 2 fingers and touch the arthritic hand, elbow, knee. She talked about arthritis was a manifestation of a lymph system that wasn't properly working. So the local work you can do anywhere. Just touch around it. You can touch through it. You can do slow sweeps, moving across the affected area. as if you were doing a massage, but like she said, just very lightly. The body will respond to light touch, just touch.
Right.
It doesn't get much simpler.
I know, it's true.
And as her book says, you got the power.
You got the power. And our book talks about the power too, doesn't it?
That's right.
Power in our fingertips. Yep.
So please pass this on to your friends, your family, anybody who would like to work with lymphedema, any lymphatic condition that you heard from Hillary. Get hold of Hillary, get hold of ourselves, go to justtouch.com. When you get this in an email, pass it on. Let's get this out to people. It's simple to do, it's easy to learn, and I'll tell you, it's profoundly effective.
It is that, yes.
So that's it for our Lymphatic Health Workshop. We'll see you all next week, next month. I got somebody there. And take care, everybody. Thank you for joining us.
Thanks.